Hello everybody, this is Jon Jones here with NuSpine, and I'm on tour out and about in Las Vegas, Nevada with one of our area leaders and franchisees, Nicola. Dr. Joe, thanks for sharing time with us. Say hello to everybody, Dr. Joe.
Hi everybody, thanks for having me here, John.
You bet. Hey Doc, briefly share with us a little bit about the clinics you have open right now and what's on the horizon.
Of course. So here in Las Vegas, we have 4 clinics open, doing wonderfully here in the Las Vegas Valley, and we have 2 open in Utah, with 2 more about to open within about the next, I'd say 4 to 6 months.
Yeah, awesome.
Yeah.
And then Dr. Joe, I know you built before your NuSpine life, you built a very successful clinic here in the Las Vegas area in the personal injury industry, and I know you have other niches as well. But tell us a little bit about how that evolution took place. How did you decide to get involved with the NuSpine brand?
So long story short, we had a very large personal injury clinic here in Las Vegas.
Yep.
We actually had a couple offices. We did that for about 21 years, focused mainly on the med legal market, work comp, personal injury. We did have a mix of cash, but it was never a big focus of ours. And after 21 years of dealing with third-party payers, dealing with work comp adjusters, dealing with all of the headaches, we had really reached kind of a maximum volume that we could do. We had our clinics really humming along, and it was max capacity, and we were doing really well. But I had come to the conclusion that was it. I just didn't have any more bandwidth to do anything else.
Right.
And to try to grow beyond that, and we did fine.
Sure.
It was a great business that we had, but I wanted to go bigger, and I knew I couldn't do it in that model. We had really reached max capacity, so that really started made me look at some other chiropractic models, and that's what got me into wellness and really kind of pushed me in this direction.
Gotcha. What else did you notice about making the shift when you got into more of a wellness model? Anything that you noticed that you maybe weren't expecting?
There's a couple things. Is number one, and I think this is the most surprising thing to me after 20 plus years of practice, and I did the math one time. It seemed like 300,000 patient visits, so some ridiculous number, and I would tell you without a shadow of a doubt I was burnt out.
Yeah.
And really just didn't have the vigor for practice. And at that point, I was really more of a manager when we got out of the previous business structure. I was a manager, but I was still burnt out. And now that with these NuSpines, I'm really reinvigorated as a physician. I really enjoy seeing patients. I don't have the burden of the administration and the paperwork that we normally do. And really just trying to satiate all these third-party vendors.
Right.
That doesn't exist in NuSpine. That doesn't exist in a cash-based practice. The relationship is between you and the patient, and you get to make a recommendation that's right for them, and you don't have to worry about anybody else. You're getting people to feel better, and that has made my life in practice and made me really, really excited to be a chiropractor again.
Yeah, great insights, Doc. And obviously there were some other options with regards to franchise brands. What particularly stood out for NuSpine for you that made you want to get involved with NuSpine?
There's a couple things, but I think the most important one for me, I do pride myself on being a clinician, being a physician, and that was something that I couldn't let go of. And when I look at maybe some of the other brands, I saw that they had become adjusting technicians and not necessarily, doctors of chiropractic.
Okay.
And in NuSpine, I think the part of it that's so valuable to me is that we do an exam on our patients, a very thorough exam. We diagnose our patients, we're giving them a treatment plan, and we're going down that path with them that we can do that. And I don't think all the other models necessarily do that.
Yeah, fantastic. I hear that a lot. Doc, share with me this. There's doctors out there that are looking to make transitions. Some have been employees. Maybe they're looking to own a clinic for the first time, or maybe they own a clinic, but they're looking maybe transition into a different model. Any advice you have for someone that wants to get into this particular type of industry and franchise opportunity that comes to mind?
I think there's 2 things that you really got to focus on.
Okay.
One of them is you have to be very comfortable in your skill set as a chiropractor. You don't have, in the NuSpine model or the cash-based model, you don't have all of the toys that you normally did in another practice.
Right.
We're not doing e-stem here, we're not doing ultrasound, and that's not a negative. To me, that's a net positive. I mean, we're promoting chiropractic, we're not promoting physical therapy. But if you need to really hone your adjusting skills, and you need to be confident in your skills so that when patients come in, you have the skills to adjust them and do very well at that.
Right.
The second thing is, I think you really need to be coachable. You know, that I came from a strong PI and work comp background. I can't say I really knew wellness at all. I think I did really well, but by the same token, I had to put my ego aside. I had to take instruction from people that knew better than me, and I had to be able to receive that in a manner that was effective and grow these clinics.
Right.
So I think that you need to be a good manual adjuster, and I think you need to be coachable.
One thing I wanted to touch base on with you is particularly, you know, I'm always impressed with your team. And as you know, when you get to this level that you're at with multiple locations and wanting to grow, you know, it's not about you. It's about the kind of team you could build, right? Mm-hmm. Comment a little bit on that. You know, what are some of the things you attribute some of your success to with regards to building a great team?
I think that this has always been my philosophy in, you know, being a team leader, being a business owner, I look at it as being a coach. You know, I don't browbeat my employees. I don't try to, you know, intimidate them into doing what I want. You know, I'm not one of those business leaders that yell and scream. In fact, I don't think any of my employees have ever seen me mad. Right. But I do have expectations. Right. And the way that I have my employees meet those expectations is through training and coaching. Yeah. You know, if somebody isn't doing things that I want or not doing it to the level that I expect, to me, it's a training and coaching issue. And if I can't train or coach them, well, then that's a different story. But I'm going to train and coach them and get them to that role. And if they're unable to do that, then that's on them. But I'm always going to look at it as my issue first and do my best to train and coach them to do the things that I need them to do rather than any other philosophy. And I think when you do that and you make people better, you get great team members. Yeah.
Doc, those are awesome insights. Thanks for just visiting briefly and sharing your views with us. And thank you so much for your leadership and for your dedication to our brand. We really appreciate you.
No, I really appreciate you. Thank you for coming out today.
You bet. Take care.
All right.